So I'll be doing a review of Maud's general yoga poses for lower back health. My name is Dr. Chad Kuntz, and I am a sports physical therapist, and I'm the founder and owner of Pr1me Movement, or Premium Physical Therapy and Strength and Conditioning Practice. And Maud has asked me, which is very courageous, to kind of critique what she's teaching, how she's moving, what she's saying. And I just thought that was amazing. Really, it's an act of honor. You know, the fact that she's willing to have someone who's got kind of a medical degree. I have a doctorate. I've been through an orthopedic residency. I've been through a lot of training. And the fact that she's willing to kind of put herself out there, right, to be a better instructor, to be able to help people move better for the sake of being humbled potentially is just a wonderful thing. So I like to kind of walk through the movements that she's doing. I won't be very exhaustive, but I wanted to kind of give you my idea of movements that she's doing and to kind of tell you a little bit about who is this for, maybe who is this not for, what you know, what could potentially be done better, what could be potentially done differently. And I just wanted to kind of walk through and just kind of use this as a platform to obviously, you know, provide continued encouragement for those of you that are watching her and working with her, because man, I just think it's amazing that she's willing to kind of step out on this edge and kind of work together. So with that being said, we're going to go ahead and just kind of jump into it. I'm going to mute her and we'll kind of scoot through this. But what I'll say is that, you know, she's opening up and talking about the fact that not one movement is perfect for everyone. And I really just want to reiterate how true that is. Really, my specialty is the individualization with everyone that comes in, because I've treated a lot of spines. And there's not really one spine that's the same. Not one person really comes with the same exact thing. There's variability with everyone, and she's saying that. And as we go through with some of these stretches, it's certainly important for you going through these as well to kind of really listen to your body. Understand that, you know, very rarely, if ever, there's binary yes, no in regards to is this perfect for you. It's almost always depends, right? As it usually does. You listening to your body during these movements to make sure that you agree with it, right? That you could go into that range, or is your body telling you not to push through with it? I think there's a certain degree of mindfulness that you should have, right? By not having a lot of anxiety with certain pain. But I'm not one that says, you know, push through this. You should listen to that. So with that being said, I'm gonna move myself so I can kind of see where she actually does the movements. All right, so we're gonna start out. She's lying on her back, and the first thing I'll say is, when you lie on your back, it is really important to try to, I'm going to draw on this a little bit. I'll pick a different color so you can see a little bit better. Let's try yellow. So when you're first lying down, just kind of first be aware about your lower back. Most people who I have seen have had back pain in this position will have almost too much of an arch. And she's talking about, you know, how you can let that go so it's flat down here. I would encourage you to kind of draw the stomach in. Okay, have a little abdominal tension. We use the transversus abdominis muscle to help do that. And this is one of the best positions you can be in just to offload the spine. Okay. Now, we can't quite see it from this angle, but if I was like above her head, you know, looking this way, you would see that her knees are kind of together and she's kind of walking you through that. This was actually an interesting thought I had. I could see this, but by the way, potentially having some back pain if your knees come together. Why? Because most people are limited into internal rotation who have had back pain. All right, and both the hips are going into internal rotation. Obviously, no pain, no problem. So if you can lie down and have your knees go together without any pain, great. And if you can feel like you can let your low back relax, fantastic. Conversely, you know, it just depends on the amount of hip motion that you have available. If you've had a history of back pain, but you feel better with your legs going out, That might be something you could talk to Maud about in terms of getting going with this positioning. All right, so she's kind of letting the knees come in closer together. You're finding that relaxation, and the width of your feet too is something to think about, right? You can see her feet are about maybe just past shoulder width. If you go further than that, that's going to require more internal rotation. And if you lack that, that could put you into what's called the closed pack position of the spine. In which case, if you're sensitized to compression, like a stenosis person, or even someone who has had a history of like disc herniation or tight muscles, you may not like that. By the way, I apologize for any background noise. This is like the only time I had to walk through this, and there's a guy that decided to have some fun with the motorcycle outside. So you're going to have to just forgive me with him having fun doing that right now. So Maud is now also going into kind of a side to side. Now this is a really interesting one. This is a really interesting one because it includes rotation. The hips, the pelvis, and the low back are all rotating. Now she's doing a good gentle job of kind of stopping before she gets through all the way the range of motion. Those who have pain, I'm going to pull up my anatomy guy here. Those who have, it's not working. All right, those who have pain in the pelvis area, this can be provocative to them. So I like the fact that she's kind of going gentle into the side to side motion, because those with sacroiliac pain, they don't tolerate too much of that compression. However, there is a cohort of people that really respond well to rotation. In fact, some of you will really respond well to one particular motion from side to side. So you might notice, for example, let me just kind of replay a little bit of this. You might notice, for example, that when you rotate, let's say just to the left, but it's kind of maybe tight and almost painful to the right, then I'd encourage you to really go into the left and kind of sink into that, because those are the muscles that you're going to need to stretch. Whereas when you go to the right, maybe if it's painful or tight, I'd encourage you to not listen, not push into that too much. So generally speaking, rotation is much safer than most people think, especially like that, and it can be very helpful for a large amount of people. And that's where I think you can kind of listen to your body to see how much you want to push into that. Okay. Now Maud's kind of walking us through a little traction maneuver here, which is a really great thing. All right, so she's pushing her hands down into the leg, which creates kind of this opening in that lower back area, which is really great. So I tend to find that that's really helpful for those who are having acute leg pain, those who've had chronic low back pain. So for those of you that really don't like the nights but are better in the mornings, this could be a really good thing at night. There's something to be said about just getting oxygen, nutrients, blood flow into the low back. And again, you're in a supportive position. So there's a lot to like about that. So we then move into what most of you know as the bridge. She cues us really well. She also gives yourself an opportunity for a little support. You can play with width of your feet positioning here. All right, the wider will require more hip abduction, but it can give the glutes a better chance to fire. This is actually creating, again, traction, right? Because you're supporting. If you have support here, right, gravity is going to push down through there, and that'll give you some opening in the lower back, which is really nice. Working on some breathing there, and then we get a little dynamic with it. So this is a cool variation, so I like this. So at this point, when she's bringing her left leg up, her core, left hip flexor is working. We're getting a little glute stability through this side. For those of you that have had back pain for quite some time, you'll tend to find that you might have one glute that doesn't necessarily fire as well as the other. And this can bring about some of that awareness. You might start to notice you're not even as stable on one side more than the other, which is very common, particularly into extension where the glutes are working. Walks right into a really nice stretch. You've got kind of the left side in this case stable. She's pulling and getting a good opening in her lower right back area, right? A little bit of the glutes. So I think that's wonderful as well. That should do pretty well for a majority of the people, I would imagine. We then move into a really nice kind of isometric, um, different way of firing muscles. Okay, and she's walking you through, don't pull up all the way here. And I'm going to kind of explain to you how this technique can be really beneficial. So actually therapists can use something called a MET, or muscle energy technique, to kind of fire a muscle to kind of reposition the pelvis. So actually you can make the argument with the way she's set up right now that she's contracting her hamstrings and glutes will actually help pull, because some of us have like a really big anterior tilt on one side. So in this case, if she had a right anterior tilt and she engages the hamstrings and glutes, that's actually a sacral muscle energy technique that some therapists practice to help with the alignment. So the other thing that is cool about this is that you can kind of see, is your bottom leg bent? Are you able to keep that leg straight all the way? I like to get a little glute activation with this one by pushing down, in this case through my right heel. That'll lock out the glute, give us a nice flat neutral spine. And then you can get some good kind of posterior chain engagement with the hamstring and glute, teaching it how to fire and stabilize from an extended hip flexion position. And that can be really nice, again, for anyone who doesn't tolerate extension of the spine. Now, I for this one, I think, again, it's good. I think in terms of caution, the caution meter, it goes up a little bit. Because a lot of people are overusing their hip flexors when they do something like this, because you are contracting your hip flexors. If you can get your lower abdominal muscles to fire more than your hip flexors when you encourage hip flexion, I think that can be really helpful, because a lot of people have a really tight iliopsoas muscle, which sits right in the front, and you wouldn't want to over encourage a muscle that's kind of working too hard. So that's where I'm guessing you'll find some people prefer it more the hamstring engagement like she did before versus the kind of hip flexor bias. So great job, Maud. So now we're going into what actually can turn out to be kind of a self-mobilization technique, again to the pelvis or to the lower back. She's using the wall to help kind of brace and give her some leverage. I actually do something quite similar to this. She's very respectful of end range of motion, what she's walking you through. I might be a little more aggressive. I might say, hey, if you feel okay with it, take it. Go ahead and take that all the way down. Incorporate the deep breathing like she's talking you through. Again, depending on your ergonomics of everyday life, right? So if you sit and you're working an office job, for example, and all this stuff's to your right, your body adapts to that. So now I'm kind of looser going to the right because I'm always doing that. So if I were her and going to the left, I might be really tight, and maybe I need that. In other words, most people will find out that they have one rotational movement that feels much better than the other. I encourage you to listen to your body with that. Okay? I encourage you to listen to your body. And if one rotation feels better than the other, you can absolutely do that. Okay, perfect. She's walking us through the other side. That all looks great. All right. For those of you, even beginners, I'm sure you've heard to some extent some level of a cat-cow, and that's what she's going through. Now, here's your little gem for me. Most people that I work with would much rather do the cat than the cow due to symptom tolerance and just simply how it's feeling. All right, so when you do this, you're getting lumbar flexion, which helps open up the spine. For my older clientele, when you go into the cow where you kind of dip down, that can be really good too. But I'll give you guys a little tip here. And she actually does it kind of really well too. 95% of the time when you have a low back problem, it's between L5 and S1, which is in this area, and it's because we're overly extending too often. Where we're not getting enough is through the mid-back to upper thoracic spine. So if you can do that in a way where you're kind of targeting and isolating the mid back to upper thoracic extension rather than low back, I think that would be wonderful. And so that's just something that you guys should play with when you're going through with that. Also, too, just making sure that you feel your core is engaging, your lower abdominals are engaging when you go into the cat. Just make sure your weight distribution is good with like a 50%, 50%, that you're not necessarily favoring upper body versus lower body when the setup. And she walks you through all of that, which is great. Okay, again, one of my most favorite offloading movements for the lower spine is this kind of child's pose move that she's going into. She's obviously got great flexibility, and guess what? It gives us good extension excuse me, of the thoracic spine. So what's really wonderful about this from my kind of a therapist perspective is that you get lumbar flexion with thoracic extension. And that, my friends, is a really sweet combo, okay? Just because most of us are doing quite the opposite. Most of us are getting a lot of lumbar extension and thoracic flexion. Okay, hopefully this is making sense so far. All right, so she's kind of walking you through, really in my mind, kind of like lumbar pelvic circles. That's just kind of something I've done in the past, which I think is great. I think that alone kind of helps just explore hip range of motion too, because a lot of us with low back pain are locking our hips. I'm going to throw out an anecdotal number, but something along the lines of 90% of people who are having back pain, they don't move their hips. They're very rigid. So that little drill that she does right there kind of opens things up. So if you notice, this is kind of a little bit more of a dynamic drill to the child's pose. We even get some calf stretches here, right? Especially if you're kind of driving the heels down. You're getting your extension, your really neutral spine with a little extension bias on the thoracic spine. Okay, so I think that position there is really good, and just getting you comfortable, getting you moving, all right, getting your lower core to stabilize you. And I also say this, we're all connected. As you know, the old song, the knee bone connected to the hip bone. Getting your shoulders to be strong is actually really important. And if you don't have, in other words, if you don't have the strength, for example, to hold yourself in that position, something has to attenuate the force, right? So if your arms can't even hold you up in that position, your back is going to have to work harder. And so that's just, what I'd like to tell you is just everything, it kind of matters in terms of the strength. It obviously depends on what you like to do on a daily basis, but strengthening your whole body can really be beneficial, again, for the back. Because if, for whatever reason, whatever you're doing, the extremities can't handle it, it gets dumped to the back. Really good classic stretch here. So if you think about it, the piriformis is an external rotator. But think about it. So you're stretching it with the hip into external rotation. Why is that? Well, the piriformis actually becomes an internal rotator with more hip flexion. That might be a lot to swallow, but I want you to think about that. That's like saying I'm stretching the bicep by doing this. You'd be like, well, that's not stretching. I'd want to do that, right? But because of the hip angulation and the mechanics and how it changes depending on the amount of hip flexion you have, the muscle literally changes its action. So that's a fun fact about the figure 4 and the piriformis stretch. It's actually an external rotator when the hip's down towards extension, but becomes a hip internal rotator as you bring it up. All right, and just kind of one last thing I wanted to walk through. Yeah, so she's getting kind of a happy baby move. What I really like to encourage with this one is getting the spine to round up and out through the lower lumbar spine, through the sacrum, to get all of this stuff right here to loosen up. Because yeah, of course you're going to get some hamstring stretch, right? But sometimes I'll see people's sacrum glued to the ground and then try to isolate this part to stretch. Let that under part go. You'll find that that is very helpful. Okay. Now, this is kind of a cool idea for those who are limited into internal rotation. And that's something I mentioned earlier. This can be kind of a more gentle way to get some nice rotation into the spine while being cognizant amount of hip mobility you have. Do I think you should probably keep improving your hip mobility to help offload your back? 100%, especially into internal rotation. Because if you don't have that, it goes into what's called, again, the closed pack position of the spine, where you get a lot of compression. Not good for a majority of people. Disc herniations, muscle spasms, muscle tightness, spinal stenosis. So Maud, wonderful job. I think, I forgot how long this is, but I think it's a really great, not only introduction, but really applies to about as many people as possible. Her awareness towards that is wonderful. She finds a real sweet spot. She finds a real sweet spot that applies to almost everyone with this set. I think it's really clean. It's really well done. There's a little opportunity for you when you're going through with it to kind of learn and feel what is best for you. I don't see too many quote unquote yellow flags or caution areas, is kind of what I'm trying to say, where I have to really, we have to really be careful on how you do some of these movements. But she does a really wonderful job here. She's very mindful of the range of motion. And I would feel really confident sending my clients to her for yoga who've had or dealt with back pain because of how gentle but efficient it is. And that's a difference. Sometimes it's gentle and it's not efficient. It's almost wasting your time if you're too gentle. You have to articulate tissue. You have to move it. It has to be overloaded to have improvement. I think that's really something important you should know. And this was a really sweet middle ground. So Maud, great job. I really don't have any negatives to say about this, and I'm being honest. I would be totally blunt and just tell you, hey, you might be hurting someone with this. But I didn't see anything like that. I thought it was really well done. And again, I'd have a lot of confidence with the majority of people going into this. So I hope that helps. Thank you. Take care.